When I first started at CDC about 2 months ago, I made a promise to you. I would tell you the truth, even if it was not the news we wanted to hear. Now is one of those times when I have to share the truth, and I have to hope and trust you will listen. I'm going to pause here. I'm going to lose the script, and I'm going to reflect on the recurring feeling I have of impending doom. We have so much to look forward to, so much promise and potential of where we are, and so much reason for hope, but right now I'm scared. I know what it's like as a physician to stand in that patient room, gowned, gloved, masked, shielded, and to be the last person to touch someone else's loved one because their loved one couldn't be there. I know what it's like when you're the physician, when you're the healthcare provider, and you're worried that you don't have the resources to take care of the patients in front of you. I know that feeling of nausea when you read the crisis standards of care and you wonder whether there are going to be enough ventilators to go around and who's going to make that choice. And I know what it's like to pull up to your hospital every day and see the extra morgue sitting outside. I didn't know at the time when it would stop. We didn't have the science to tell us. We were just scared. We have come such a long way. 3 historic scientific breakthrough vaccines, and we are rolling them out so very fast. So I'm speaking today not necessarily as your CDC director, or not only as your CDC director, but as a wife, as a mother, as a daughter, to ask you to just please hold on a little while longer. I so badly want to be done. I know you all so badly want to be done. We are just almost there, but not quite yet. And so I'm asking you to just hold on a little longer, to get vaccinated when you can, so that all of those people that we all love will still be here when this pandemic ends. The trajectory of the pandemic in the United States looks similar to many other countries in Europe, including Germany, Italy, and France, looked like just a few weeks ago. And since that time, those countries have experienced a consistent and worrying spike in cases. We are not powerless. We can change this trajectory of the pandemic, but it will take all of us recommitting to following the public health prevention strategies consistently while we work to get the American public vaccinated. I'm calling on our elected officials, our faith-based communities, our civic leaders, and our other influencers in communities across the nation. And I'm calling on every single one of you to sound the alarm, to carry these messages into your community and your spheres of influence. We do not have the luxury of inaction. For the health of our country, we must work together now to prevent a 4th surge. And after that honest plea, I want to reflect on so many reasons we have to be hopeful and why your actions today can get us out of this soon. As I shared last week, we continue to get more and more real-world evidence on the protection of COVID-19 vaccines provide. And CDC scientists have been working since these vaccines were first authorized to expand the evidence supporting their effectiveness. Today, I'm excited to share information about a new CDC-led study that's being published in the MMWR. This study assesses the real-world effectiveness of the Pfizer and Moderna vaccines in preventing infections among nearly 4,000 healthcare personnel, first responders, and other essential workers in 6 states from mid-December to mid-March. The study found that the risk of infection was reduced by 90% after individuals received the 2 recommended doses of the vaccine. The study also found that people starting to get a protective effect even after the first dose, the risk of infection decreased by 80% after 2 weeks. Findings of this are all consistent with the clinical trial data. Importantly, people in the study received self-collected nasal swabs each week for laboratory testing, allowing CDC to look at evidence of COVID-19 infection whether or not people had symptoms. A small number of infections were asymptomatic. However, most infections occurred among people whose infections were identified by testing before they developed symptoms or knew they were infected. This study also demonstrates that 2 vaccines can reduce the risk of COVID-19 infections, not just in symptomatic infections, but also in asymptomatic or pre-symptomatic infections. This study is tremendously encouraging and complements other recent studies published in New England Journal of Medicine and discussed by Dr. Fauci last week among similar populations at high risk of exposure to COVID-19 because of their occupations. These findings also underscore the importance of getting both of the recommended doses of the vaccine in order to get the greatest level of protection against COVID-19, especially as our concerns about variants escalate. Our national vaccination efforts are working. As of yesterday, over 93 million people have received one or more doses of vaccine, and over 51 million people have been fully vaccinated. And CDC is collaborating across the government with our state, territorial, local, and tribal partners to get vaccines to communities and to get vaccinations into arms as quickly as possible through a multitude of channels, including the federal retail pharmacy program, through FEMA's community vaccination centers and mobile clinics, and through HRSA's community health center program. These efforts are rapidly advancing our goal to getting 200 million shots in arms during the first 100 days of this administration. Over 1 in 3 adults in this country have already received one dose. Finally, I want to share today that CDC is making important updates to the list of underlying medical conditions that can increase risk of severe COVID-19 outcomes. This update is keeping up with my commitment to lead with science, to have clear information on our website, and to better describe the science underlying these conditions. After a thorough review of the evidence, we have simplified the list of underlying conditions for consumers and created a new page for healthcare providers. This will make it easier for patients and the public and providers to understand the important information related to their underlying medical conditions and its potential impact on COVID-19 severity. We have also updated the list of underlying medical conditions to include substance use disorders based on evidence that having these conditions can increase risk of severe illness or death from COVID-19. You can now visit the CDC website to learn more about these underlying medical conditions and the science evidence used to support their inclusion in the list. I reach out to you both with my concerns and also my hope, so that you can all be here to hear this message, healthy and vaccinated in the months ahead. Thank you. I will now turn things over to Dr. Fauci.